Hi, my name is Christy.
My name is Clarice.
My name is Yushin.
We are a group of Year 9 students from Shatton College. This video is for our community project at school. It is a project where we plan and help a community of our choice.
Our topic is dysphagia and our aim is to introduce you about it and one of the solutions to it.
This video includes an interview with Dr. Chan from the University of Hong Kong.
And a tutorial of how to make soft meals.
We would appreciate if you give us some feedback in the comments after watching.
Let's get started.
Hey Clarice, do you know what dysphagia is?
No, what is it?
It is swallowing disorder, a very common illness in the elderly. Elderlies with swallowing disorder cannot swallow food or talk properly.
How do you know that?
My great-grandma had swallowing disorder. It is hard for her to eat and swallow food properly. The food that she eats is very special. The food is blended into puree form. In the nursing homes, all the food is blended together and it doesn't look very nice. One time, we bought a ready-to-eat abalone soft meal. I have tried some of it. It is soft and melts in my mouth, making it easy to swallow. It even tastes nice. My great-grandmother was very happy and liked it a lot.
I see. Let's go to the University of Hong Kong to find out more about dysphagia.
We are glad to have Dr. Karen Chan, Associate Professor from the Faculty of Education of the University of Hong Kong with us today to talk about swallowing disorder. The medical name is called dysphagia. She is also the Director of Swallowing Research Laboratory. She specializes in swallowing and motor speech problems in post-stroke individuals, head and neck cancer survivors, and frail elderly. Welcome, Dr. Chan.
We know that dysphagia is a serious problem in the elderly. What is dysphagia and is it an illness?
Dysphagia refers to any difficulties that you may have from the moment you put the food in your mouth until the food actually arrives at the stomach. So in between this process, if you have any problem at all, that's dysphagia. So some examples could be you have difficulty chewing the food, you have difficulty in actually swallowing the food so that you would choke every time you swallow something. So that would also be dysphagia. So you can hear that it's actually a wide range of symptoms that may end up in being called dysphagia.
So what are the causes of dysphagia and why does it often happen in the elderly? And how common is dysphagia among the elderly?
Okay, let's see if I can remember all the questions. The first one is the causes, right? So causes, let's just look at adults with dysphagia. I'm just going to not talk about children for now. So for adults, they can be because of stroke, because of any head or brain injuries, could be because of dementia, Parkinson's. So these are all brain related diseases. So they may all end up having dysphagia. It could also be some structural issues. So if you have a surgery on your tongue because of cancer, for example, if you cut part of your tongue away, if you remove part of your larynx or pharynx, so muscles and structures in the neck, that may also end up with swallowing problems. The third type could be aging. So as you age, your muscles would start to deteriorate. At some point, if the deterioration gets too severe that it affects normal swallowing, then that could become dysphagia as well.
So why does it often happen in the elderly?
Okay, so with elderly, so as we age, our muscles usually start to get weaker, right? So what we know from research is elderly takes more time to do the same swallowing process as younger people do. And also the way we move our larynx, so the structure in our neck, is also different in elderly. And these differences increase their risk of choking. So again, if the deterioration gets too severe that it passes the normal range of normal aging, then that becomes swallowing problem. So it's very related to the muscle weakness and also to the processing speed they have in the brain, that they need more time to coordinate. So if the deterioration of the brain and the muscles get too severe, they are more likely to have swallowing problems. Plus, as you age, you are more likely to have different chronic diseases, right? So as you age, you are more likely to have stroke, you're more likely to have dementia, more likely to have Parkinson's. And like I said, all these diseases would put you at a higher risk of having swallowing problems. So if you put everything together, then the elderly would have more chances of having swallowing problems. Okay, third question.
So how common is dysphagia among the elderly?
Okay, how common? We don't have an exact figure as to what percentage of elderly in the community, as in the whole, aging population, what's the prevalence. What we know, at least for Hong Kong, in nursing homes, roughly we are looking at 60% of the nursing home residents would have different levels of swallowing problems. Elderly who are frail and needing some daycare services, so they can still be living in their own home, but receive some daycare services for rehabilitation or just for training. In daycare center, it's roughly 40% of the elderly would have swallowing problems. But these are all the more frail elderly. So if you're looking at everybody together, healthy and frail elderly at the same time, we may be looking at something like 10-15% of elderly may have swallowing problems.
Okay, I see. So how do we know that an elderly has swallowing disorders? Are there any symptoms or anything?
There are some common symptoms. Usually, if an elderly would have swallowing problem, you will start noticing they will get thinner and thinner. They will lose weight because they are not eating well, they're not drinking well. So it's likely that they will lose weight. Second item is they will cough a lot during mealtime. So when they drink, when they eat, if you see that every single meal, they would cough because they are choking. Something enters their lung, enters their airway, then that's a signal that this person is not swallowing well. Another sign I would recommend to look for is to check their body temperature every now and then. If they have a low fever, like a consistent low fever, always at 38 degrees and not having any other illnesses, that could be a sign that they have pneumonia. They have a lung infection because they are aspirating too much food into their lungs, and so the lungs has an infection. And usually the first sign you would notice is they have a low-grade fever, so always a 38-degree kind of fever, plus they are starting to have some breathing difficulties. It's like they're always out of breath. Then that's a sign that they may have swallowing problems and aspiration pneumonia.
How dangerous is it if an elderly has swallowing disorders?
It can be fatal. So for example, if somebody is not swallowing well, I know that person doesn't swallow well already, and I give that elderly something sticky to eat, that food could be locked in the throat, and there's an immediate danger that that person can't breathe. So they can choke to death right there in front of you. So it can be fatal. Less severe, maybe they have swallowing problems, so they choke every time they eat, but we don't know, and they keep eating and they keep drinking without any treatment. And with time, then they may start to get lungs infection. So with aspiration pneumonia, usually for elderly, they need to be hospitalized. And we know that when an elderly has pneumonia, their whole body will becomes more frail than before. And if they need to be hospitalized, that deterioration in health, general health, will drop very quickly. So they with the swallowing problems may have just triggered one thing, but because of that pneumonia, then the whole, other systems may also start to fail. And so it can become very dangerous for elderly.
What could we do if we find out that an elderly has dysphagia? And are there any treatments available?
First thing is to see a speech therapist. So a speech therapist is responsible for assessing and treating anyone with swallowing problems. So if you feel that that elderly may or may not be eating well, you can talk with the doctor, and usually the doctor will then refer the patient to a speech therapist, or you can just go directly and find a speech therapist for a full assessment. So once it's diagnosed by a speech therapist that this elderly has dysphagia, has swallowing problems, and we usually will find out why this elderly is having a problem. Is it because of dementia, because of muscle weakness, because of stroke? So we will try to find out why, what's going on. Once we know what's going on, then we can design an individualized treatment program for this elderly. And we can then follow this treatment program to help the elderly to regain some of the swallowing functions. Sometimes if that's not possible, at least to maintain the current swallowing functions so that the functions won't deteriorate with time.
How does dysphagia affect the elderly, both physically and mentally?
Physically, if you can't eat well, if you can't drink well, then you are at a high risk of having dehydration, so you don't have enough water in your body, or you may have malnutrition. You don't have enough nutrition in your body because you're not eating well, you're not drinking well, right? So that's common to see in elderly with swallowing problems. And like I said, if you don't eat well, if you don't give the right type of food to the elderly with swallowing problems, then they may choke, right? Mentally, so we talk about quality of life. We know that if I say from now on, you can only drink thickened water, you can only eat porridge-like food, nothing else. You can't have any fries, you can't have any chips, no ice cream. Okay, how do you think you will feel? Not happy, right? So that's exactly how the elderly feel. They suddenly can't eat the things they used to have. They may have been going to dim sum, yum cha for like the past 40 years, and now suddenly they can't do this. So it greatly affects their quality of life. They can't do the things they like anymore. They can't go to family gatherings. How many of your family gatherings, celebrations would be food related? Almost all, right? If we have a birthday, we eat for birthday party. Chinese New Year, we eat together, especially in Chinese families, right? So we know that if they have any swallowing problems, it will affect their social gatherings, affect their relationship with the families, and the person will be not happy. They're more susceptible to be depressed, and they just feel more detached from the rest of the world because they now can't participate in many of these activities.
As soft meals are drawing social attention, what should we be aware of when we're making soft meals?
Soft meal is one type of dysphagia diet. So assuming soft meals, meaning that you make the puree food prettier in different shapes. So when we prepare this, we need to be aware that who's going to eat this type of food. If that elderly who needs the puree can only tolerate food that is very soft, food that is a little thicker than usual, just running water, then when we prepare the soft meals, we also need to be aware the final product. Would that be too hard? Now that we have the shapes, would that be too hard for the patient to swallow? Would it be too slippery? It moves too fast for the patient to tolerate? And also the final product, would it have some dripping sauces that comes out of it? If there are, if there are some dripping sauces, that sauce may be too thin, what we say too thin for the patient. that means the sauce will move too quickly in the throat, and that might cause choking. So we need to make sure that in addition to being pretty and taste nice, swallow safety should be the main concern too when you design your soft meals.
We are going to try to prepare soft meals. Can you give us some tips on how to prepare them?
You have to choose the ingredients very carefully. So from what I know, there are some ingredients that will be very difficult to make into a puree. For example, some veggies may be too watery once they're cooked. It comes out with too much water from it. So those kind of veggies won't be good for making a puree. There are also some ingredients that are too fibrous. So for example, corn. It's hard to get all that shell, that skin, that coating from the corn. And that kind of fibrous texture will make your final product not smooth enough for somebody who needs a smooth puree diet. So choosing the ingredients will be necessary.
We will be aware of that when we make our soft meals. Thank you, Dr. Chan, for being here with us today.
Thank you.
We want to see how easy or difficult to make a homemade soft meal. Today, we will make a Japanese curry with potato and chicken. Before starting, remember to seek advice from a speech therapist or doctor. Also remember to check the amounts of water and soft meal enzyme gelatin needed for the suitable hardness for your elderly. Today, I am going to make a soft meal of Japanese curry with potato and chicken.
We will need 100 grams of potato and 100 grams of chicken. Boil the potato until fully cooked. Fry the chicken until fully cooked. For the curry sauce, you'll need 150 milliliters of water and some curry paste. Mix the curry paste in the water until it is melted. The ingredients you need are potatoes, chicken, soft meal enzyme gelatin, curry sauce, and liquid thickener for the curry sauce. For the equipment, you will need a weighing scale, a measuring cup, and a blender. For the molds, you can use silicone molds or make your own mold using tin foil. Here is a tutorial of how to make the potato mold. Wrap the potato with plastic wrap to ensure the dirt doesn't get onto the tin foil. Then wrap the potato with tin foil. Trim the tinfoil to create the potato mold.
Next, add the potatoes and 50 milliliters of water in the blender. Blend for around 2 to 3 minutes until smooth. Prepare 2.3 grams of soft meal enzyme gelatin. You must make sure to check for the suitable amount for the hardness you want. Put the blended potato in the pot. Add the enzyme gelatin slowly while mixing the blended potato. Cook until it boils. Spoon the potato into your mold. Let your potato cool for a few minutes until it becomes jelly-like. After that, add the chicken and 100 milliliters of water in the blender. Blend for around 2 to 3 minutes until smooth. Prepare 3 grams of the soft milk enzyme gelatin. You must make sure to check for the suitable amount for the hardness you want. Put the blended chicken into the pot and add the enzyme gelatin slowly while mixing the blended chicken. Cook until it boils. Spoon the chicken into your mold. Let your chicken cool for a few minutes until it becomes jelly-like. Carefully get your soft milk potato out of the mold. Cut it into pieces. Carefully get your soft milk chicken out of the mold. Place your soft meals onto the plate. Measure 2.3 grams of the liquid thickener for the sauce. Slowly add the liquid thickener into the curry sauce while mixing. Pour the sauce onto the soft meal. Ta-da! Your homemade soft meal is finished.
Let me try the chicken first. Wow, it tastes very nice. I can swallow it without chewing it at all. Let me try the potato now. It tastes like mashed potato, but it's very soft. The curry is quite thickened, and the texture is like jelly.
If you realize an elderly has swallowing problems, remember to seek a speech therapist immediately. You can also buy ready-to-eat soft meals in shops, or you can make your own soft meal using soft milk enzyme gelatin. We hope you enjoyed this video.